Electroconvulsive therapy, or ECT as we tend to call it, is widely used to help people who are suffering from severe depression or from depression that hasn't responded to drug treatment. Many people who've had ECT say it's no more upsetting than a visit to the dentist. A small dose of electricity is passed through the brain to induce a short fit, and a general anesthetic and muscle relaxant drug are given so that the patient is asleep for the duration of the treatment, which lasts just a few minutes. About 70% of patients respond to ECT, which is the fastest and most effective antidepressant treatment that we've got.
Hello, my name's Rupert McShane. I'm one of the psychiatrists based in Oxford, and I have responsibility for the ECT service. This video is designed to try and help you make a decision about whether ECT is the right treatment for you. But this decision should always be one that you've made in conjunction with your own doctor. ECT is the fastest and most effective treatment that we have for depression. And that's why we tend to use it for people who haven't responded to their antidepressant medication. The ECT service in Oxford is based at the Warmford Hospital, and the service here was in fact one of the first to be accredited in the country. What this video will do is to talk you through the process of ECT.
Mr. Peters is suffering from a depressive illness and is coming to the ECT suite with a nurse from his ward for his first ECT treatment. You will be accompanied to the ECT suite by a nurse who knows you from the ward where you're based.
Good morning, Mr. Peters, isn't it? My name's Sandra. I'm one of the ECT nurses here. I'll be looking after you while you have your treatment. If I could take the notes, you'll have a few minutes now if you wanted to go to the toilet before your treatment. Okay, I'll come back when we're ready for you.
Thank you.
Okay, we're ready now. If you'd like to come through.
Okay.
If you'd like to come through, Mr. Peters, and if you'd like to get up on the trolley, can you take your jacket off?
Yeah.
What we'll do is we'll put the jacket under the trolley while you have your treatment.
You don't need to get undressed for ECT, but any metal hair clips or dentures will need to be removed.
Sit on the bed.
It's also helpful if you have thick nail varnish, if you could take this off at least one finger to prevent interference with the saturation monitor. When you come to ECT, an identity label will be put on your wrist.
I understand the doctor's explained ECT to you,
Yeah.
and you've had the written information about the treatment.
Yes.
Is there anything that you'd like to ask before you have your treatment?
It won't hurt, will it?
No, it's not painful. You'll have a general anaesthetic, so you'll be asleep and unconscious while you have your treatment.
Okay.
Okay. Before you go into the treatment room, I just need to take your pulse and blood pressure. Just routine observations that we do beforehand. So if I could put that little finger on that hand, and I'll do your blood pressure. Can I just have your arm? Okay. And I'm just going to put that out. It'll probably feel quite tight on your arm as it goes out. I suspect you've had blood pressure taken before. That's all perfectly normal. What I'll do is I'll ask the anaesthetist to come through and have a chat with you before your treatment, and you'll have the opportunity to ask her anything that you might want to. Michael's here now.
Hello, Michael.
Hello.
I'm anaesthetist Dr. Prabhu, and I'll be giving you general anesthetic for your treatment. Okay. How are you feeling today?
Okay.
Alright. Do you mind if I ask you a few questions?
No.
Alright. Did you have anything to eat or drink since midnight?
No.
That's good. And have you had any general anesthetic before?
A long time ago, yeah.
Okay, there wasn't any problem.
No.
No. You're not allergic to anything, are you?
No.
No, okay. Any loose tooth or caps, crowns, dangers?
Not loose, I've got caps, but not loose.
Okay, good. And any problem with your spine, your neck or your back?
No.
No, okay, that's fine, good. So what we are going to do now is we are going to take you across into the treatment room. Any
Okay.
questions you want to ask about anesthetic?
No, I don't think so.
It's going to be a very short general anesthetic lasting 3 to 4 minutes.
All right.
Okay? Alright, so let's go through them.
Good morning, my name's Caroline. I'm an anaesthetic nurse. I'll pop this on for now. We'll swap these over in a moment. Now these little sticky dots, I need to place them on your chest. Okay. They're just a bit moist. There we go. Sorry. Okay. All right. Excuse me.
Okay, Mr. Peters. My name's Dr. McShane. What I'm going to do is I'm going to be giving you your ECT this morning. And just before I do, what I'd like to do is pop some sticky monitors on your head so that we can keep track of what's going on while you're asleep. Okay?
Okay.
Just okay. There's one in the middle just there. And one on the other side, just above your eyes. And under ear. That's there. That's good. On this side. And the other ear. Just a little bit of pushing, just while I make sure they're on. Good. Is that comfortable?
Yes, that's okay.
Thanks. Good.
Just going to put a cannula in back of your hand. It's just going to be a tiny scratch coming up, alright?
I need to squeeze your wrist.
Okay.
Okay. What are the sticky things for? Put on on my head?
They're to monitor what's going on while you're asleep.
Right.
Okay.
Okay, now I'll be drifting you off to sleep. Okay, and then it will be done all comfortably. Once it's finished, we'll be waking up in the recovery room. Okay?
Okay.
The patient receives 2 drugs through a vein. One is a general anaesthetic that sends them off to sleep. The other causes the muscles to relax, so the intensity of the movement during the fit is reduced. The patient is given oxygen and a mouth guard is inserted to prevent any damage to teeth as the jaw clenches during the fit.
Okay.
Okay, we have a light pressing now.
The length of the fit varies from patient to patient, lasting between 10 and 90 seconds. Occasionally, if the patient doesn't have a fit, then a second or third treatment can be given while the patient is still asleep.
I think you started to breathe now. So.
Patients usually start to breathe within 2 minutes, and at this point, go through to the recovery room.
This is Michael, who just had his ECT and everything went well. Okay. Thank you.
Thank you. Okay, can you hear me, Michael? Right, you're just waking up now. Okay. Emma's with you. You know Emma from the ward, don't you?
Whilst you're in recovery, the nurse who came with you from the ward will stay with you at all times.
Are you comfortable? Do you feel comfortable? Good. Okay, I'll leave that there. It's just a little bit of oxygen to help you. Okay. Okay, Emma will keep an eye on you for a few minutes. I'll be back in a second, alright?
Thank you.
Thank you.
Typically, people stay in the recovery room for 10 to 20 minutes before going on to the tea room to have a drink and a biscuit. Sometimes people feel better immediately after their ECT treatment, but to start with, this can be just for an hour or so.
Wasn't too bad then, was it?
No, not bad at all, really.
After you've had your treatment, you'll go back to one of the wards, have some lunch and relax. And if needs be, you can lie down on a bed if you're feeling particularly tired until it's time to go home. If you're having ECT as an outpatient, there are one or two extra things that you need to know about. These are all included in a leaflet entitled Outpatient ECT, which you should have available to you. The first thing is that although the general anaesthetic that you'll be having is really very brief, it's sensible to take a few precautions. The precautions that you should take are, firstly, that you should stay in hospital until 3 o'clock that afternoon. The second is that you shouldn't drive for 24 hours and certainly shouldn't drive home. The third thing is that you should have somebody, a responsible adult, with you overnight. So you shouldn't be going home to an empty house. The principal side effects of ECT are that sometimes people feel a bit stiff, and that usually responds to paracetamol. Sometimes people have a bit of a headache, and similarly that responds to paracetamol. More rarely people feel a little bit queasy. One of the side effects that people do worry about is the effect on people's memory. It's important to understand that the most robust finding about people's memory with ECT is that people's memory improves on average. And the reason for that is that when people are feeling depressed, their concentration is poor and their ability to remember new things is not as good as it should be. That said, there are some aspects of memory problems that we do pay particular attention to. It's common for people to feel a little bit muddled for about an hour or so after ECT. This may include, for example, being unaware of what day of the week it is. It's also quite common for people to find that they have a poorer memory for events that happen during the course of their ECT. For example, you may find that you forget a phone call that somebody has made to you while you're in hospital. This sort of problem remembering new material resolves within about a month or two of the end of the course of ECT. So after the course of ECT, there's no evidence that people's memory, their ability to remember new things, is affected in any way. Finally, there are a few people who complain that they have a loss of some personal memories, things that happened in the years before the ECT. When that happens, this loss can sometimes be permanent. The sort of things that people tend to forget most readily are things that are not particularly personally important. So, for example, events that have happened in the news that one knows about, or, for example, you might forget that you'd bought something and you get home to find that you don't recognise it. What we've recently come to understand is that by altering the treatment parameters of ECT, we can minimise these effects on memory, and we make every effort to do that.
So, in summary, ECT is a safe treatment and is the most effective antidepressant that we've got. Occasionally, people may have some loss of personal memories. However, it's true to say that the change in their thinking that people most commonly notice with ECT is that their thinking becomes clearer. This is because their concentration improves as their depression lifts.